honored to be here. Pauline has been such an amazing volunteer of ours for at least 6 years now.
7.
More. 7 years. So thank you. Pauline has actually been one of our top, and last year was our #1 top fundraiser for community teams, and a lot of that comes from this event. So congratulations. Our organization is currently funding $29 million between both Rhode Island and Massachusetts in research. So it's really exciting. Everything that you guys are doing in supporting Pauline is directly affecting our community. So again, thank you very much. I'd like to take this opportunity to invite Dr. Rocha up from Hawthorne Medical Associates, and he's going to give such a wonderful little pep talk.
Don't touch the bow tie. So this is the first time I've had a real bow tie, I have to say. So. Amanda helped tie the tie, so we thought it was going to be one of those ones like the clip-ons that I had as a kid. Thanks for having me here, and this is a really wonderful event. This is part of Heart Month. February is Heart Month, and there's been a lot of activity. And this is kind of a nice way to wind down or wind up Heart Month, so to speak. And, you know, I was asked to speak a little bit about women and heart disease, and I think that that's something that is really important for us to think about, because most of the studies in medicine and cardiology are really, they don't really include enough women. So our data isn't quite as good, and women don't always present the same way as men do for heart attacks. And a little story, when I remember as a medical student, and I can still remember that, it's a little while ago, but you know, there was this elderly lady that came in, and you know, when you read the textbooks of medicine, you know, you're supposed to have these people that come in with squeezing chest pain or tightness down their arm, up their jaw, sweats, nausea, shortness of breath. You know, so as a medical student, that's, you've got that in your head. You're like, okay, all right, I know what they're supposed to look like. But you know, this little lady came in, and really her biggest complaint was fatigue. And she had a little bit of discomfort underneath both of her ribs, but not the textbook. And you know, as a medical student, I'm like, oh, this can't be a heart attack. You know, I'm working with the residents and the rest of the team, and lo and behold, she had a heart attack. So one of the things we have to really think about is that heart disease and heart attacks affect people differently, and we just have to be mindful of that and making sure that when we start to have the signs and symptoms of something that we need to be checked out. So, you know, although chest discomfort, pressure, tightness, squeezing, burning in the left side of the chest is still the #1 symptom that women have, we have to also be certain that other things, such as arm pain, back pain, shoulder pain, sweats, nausea, abdominal discomfort in the right setting could also represent a heart attack. You know, if you ate something and it was a little spicy and your stomach's upset, it's still probably the spicy food. But if something's not right, get yourself checked out, because you never know when that symptom could be more important. And one of the things about women is they oftentimes have symptoms that are not as classic as the chest discomfort. So just keep that in mind. The other thing to think about is anybody that knows about what I've been trying to do in the community, it's really about prevention, also recovery, and the role of lifestyle can't be underestimated. If we could actually write a prescription for lifestyle, it would have the biggest impact beyond what our pills and procedures can do. And they're important, but the most important physician for any patient is themselves. When we look at studies of lifestyle, there's a big nurses' health study that published information within the last 2 years about people in that study, women that had heart attacks. And they came up with 6 things that they basically found that would lead. So if people adhered to these 6 things, they probably wouldn't get a heart attack. And if they did, then they were much higher risk to have a heart attack. And they were really pretty simple. A healthy diet, moving, exercise, not smoking, a normal waistline, staying away from TV, and a little bit of alcohol. So if people adhere to a little bit, one glass, not a bottle. I drink one glass. We've all seen that giant glass, right? So, these are the things that are really responsible for preventing 70 or 80% of heart attacks. And actually, about 50% of heart failure can be reduced by living healthy. So we should all really think about how can we as a community really come together and do those things and really take the steps necessary to take care of ourselves, take care of our health, because it is that important, right? You know, many of you people here have some very heart-wrenching stories or some very powerful stories, and that's what changes people, right? The stories, you know, I can talk about all the data and all the things, you know, but really it's the stories that really resonate with people that change people's behaviors, and that's what we're really trying to do. You know, at the end of the day, we're trying to reach out to one another in our community and relieve other people's suffering, prevent people from having their first event, prevent people from having another event. And it's not all just lifestyle, right? Unfortunately, many people out there have genetic problems. They may have high cholesterol or high blood pressure, and it's really not their fault. But making sure that you know your numbers though too. So right, you should really make sure you know what your blood pressure is, know what your cholesterol is, make sure you don't have diabetes, and know that your blood sugars are okay, because all of those things are really important to know or treat. You know, you don't want that scenario where the first time you find out you have diabetes is when you're rolling in with your stroke or heart attack, right? So that's not the direction we want to be doing things. How long do I have? What, an hour did you say? The slides and everything else? So, if anybody's interested in the work of the New Bedford Wellness Initiative, there's information over there. You can catch me I'm going to be here all night long. So if you want to catch me, ask a question, you know, our New Bedford Wellness Initiative now has about 2,700 people on Facebook. We have a weekly program at the Boys and Girls Club. We have been showing movies, we've been doing walks, we've really been trying to get people out there and get moving. And I really think that in the next 5 years we're going to realize that that's going to be the direction that medicine is going to head, is to try to prevent things. And actually, just to share this with you, so at the beginning of this month, we have a monthly wellness walk, and we were at the North Dartmouth Mall. And I typically have 5 or 6 of my patients that are there, bypass stents. So one lady that was walking with me, the last time she had a stent placed, it really had kind of struggled walking the mall. We usually do 2 miles, so I kind of walked with her. She's huffing and puffing a little bit. I was a little bit concerned. She just started cardiac rehab, but you know, I feel pretty comfortable that anybody that wants to come and walk, there's no rush. They can walk at their own pace, and if they want to cut out after one time around the mall, that's fine. But the reason to continue doing what I do is the last walk was, so we finished up our four trips around. She waved at me. She said, "I'm going to go another one." So what we're really doing is trying to get people back in the game too. And one of the things that happens to a lot of the patients I take care of is they're afraid. They're afraid once they have their event that their life has changed. And what I can tell you is that we're here to help you as cardiologists get back in the game. So I will end with that. And if anybody wants to chat, I'm happy to talk with you. I'm really honored that I was asked to speak this evening, and have a wonderful evening. Thank you.
Thank you.